Good morning all. Myself Dr. B Biradar from Shree B Kankanawadi Ayurvedic College, Belgaum. Right. So today we will discuss about basic examination of eye with the help of ophthalmoscope. Right. So you have various scopes. Scopes means to see the things, to observe the things. Not always seeing, like stethoscope, whether where you cannot see anything with the stethoscope, just you listen, right? So ophthalmoscope is an instrument with which you examine the eye, right? So this instrument is in practice since long. Now whatever the existing thing is there, you might not have operated button phones, right? You all have smartphones. This is a smartphone. So earlier versions of these ophthalmoscopes are not in practice. So simply wasting on time on those is not required. So whatever available models are there, that you understand how to use them, right? So this is an ophthalmoscope. You have various mobiles, iPhones, right? MI, Poco, all are smartphone only. But there is some difference in buttons, some side buttons, some operates with the face recognition, right? Similarly here all manufacturers manufacture their ophthalmoscopes with a bit of variation, right? So with a bit of variation, and that variation makes the price difference, right? So this ophthalmoscope is an instrument which is used for examination of anterior segment as well as the posterior segment of the eye. How to hold this ophthalmoscope, what are the parts of this ophthalmoscope, right, and what things that we can examine with this ophthalmoscope we will see in detail, right. So this is an self-illuminated instrument. This is an self-illuminated means here the light is being emerged out. So for light emerging means it requires some source of energy, and that energy is stored here in the back portion of this, right. So this model is coming with the rechargeable handle, right. Here you can put your mobile charger and charge this ophthalmoscope, right. And this instrument also comes with the rechargeable handle, but the battery cost is very high than the instrument cost. So we have changed it to the removable batteries, and that to small pencil cells, right. This made of this instrument is Keeler, made of this instrument is Zoomax, right. Both are instruments called as ophthalmoscope only. This ophthalmoscope has three parts. One is body, neck and the head portion, right. Head portion is detachable. Head portion is detachable from the neck. Do not practice this. Practice only how to handle the equipment. Why they have given this facility means we have different options. Some instruments are coming with the combined models of otoscope, ophthalmoscope, retinoscope, right. Some instruments are coming with the only ophthalmoscope and retinoscope. So in that situation, remove the head and replace with the retinoscope. The same mechanism can be used. For the sake of portability and for the sake of convenience, this is being made, right. So this is head portion, neck portion, and this is body. Body has a rotating switch. This switch is called as illumination adjustment power switch. We have switchboard here, right. You simply put on the switch, you will get the light. But this switch is a bit different switch. Hold it and gently rotate it. So as you move, the intensity of the light changes. So intensity adjustment power switch, right. This portion is called as intensity adjustment power switch, and the body has the power segment that has the power storage. Two surfaces, right. This head portion has two surfaces, one anterior surface, posterior surface, and the side. So this instrument to be held in hand like this. Put your thumb over here so that you can operate this rim, right, and put your index finger over here. This is the way to hold this instrument like this, right. So here two surfaces, one is anterior surface and posterior surface. Posterior surface has three components. One is the lens indicator. This small window is called as lens indicator. Second window is viewing window. It's called as viewing window. And the third one is, this is the headrest, where you have to rest your head. Lens indicator, viewing window, headrest. These are the 3 points in posterior surface. And sidewise we have a wheel, giant wheel, that is rotating wheel, right. This wheel has a provision of lenses starting from 0 to 40 plus and minus. So totally 80 powers are available in this lens tray, right. Kitna? 80. 0, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 14, 16, 18, 20, 24, 30, 36, 48. That's all. Up to 40. In between powers are not available, right. So this arrangement of ideally made, right, and placed in this tray. So whole instrument works with that tray only, right. Your mobile battery might be of 4 kilowatt, 4000 mAh, yours may be 5000. So similarly, some companies, they skip some of the powers and prepare the tray. Some companies give you the provision of giving you one extra notch, so that maximum number of lenses can be given, right. So based on the model, the price varies and the number of lenses varies. But remaining features like whatever the filters and all provided in this are in all the instruments are the same, right. Next, anterior surface, we have two structures. One is this filter knob. So initially this is normal light, right. If I put the filter, this is half reduction. This is half reduction filter. Means whatever the intensity, these things to be seen in a dark room. So if I put this knob in the middle, this is full illumination and this is half illumination, right. I will give you in your hands, you can operate this and then you see the difference, right. And this is which color? Green color, but this is not called as green color filter, right. This is called as red free filter. This is called as red free filter. Means when you see an object of red color through the green light, the things which you need to see is made prominent. The red color is freely visualized and remaining things are masked, right. And this filter is used for identification of vasculopathies, and vessels carries blood. So whatever the things are happened with the blood and the blood vessels is identified by the red free filter, okay. So this initial knob is of filters. Next we have this rotating knob. This gives you various shapes, right. Initially the smallest one is called macular hole, that is smallest illumination. Second one is intermediate illumination and the third one is full illumination. Full, intermediate and macular hole. This is a gauze called as glaucoma gauze with a center pit. That I will show you how to calculate that. That is called as glaucoma gauze, right? And this is a slit, right? And this is blue color called as cobalt blue filter, right? And again macular hole, intermediate, full, glaucoma gauze, slit, cobalt blue filter. Got it? Repeat. Glaucoma gauze, slit, cobalt blue filter. Got it? And this is half illumination, full illumination and red field filter. Now we will learn what thing when to use, right? When you are in the beginning stage, you have started the examination, do it with focal or diffused illumination, right? Diffused illumination, that is full illumination. You start seeing the things, then this is full illumination, right? And if you want to see anything specific, then you reduce the size of illumination so that the rest of the things are not seen. For this, we have an example, right? Now you all are looking at me with your both eyes open, right? Close one eye and make a small hole and look at me. Close your one eye, you have to wear glasses, no other choice, right? And look through a small hole. Do you find any change? What change you noticed? Surrounding things are masked, so your full focus observation is at the single object, right? So for this reason, the diffused illumination, intermediate illumination and the macular hole is being made, right? Number one. Number two, we have next illumination is glaucoma gauze. So we have a cup and disc ratio, that is, so optic nerve is a bundle of fibers that has originated from the brain, enters into the orbital cavity and enters into the globe through multiple perforations at the posterior pole called as lamina cribrosa, right? Lamina cribrosa, where the multiple small holes are made by the optic nerve to enter inside the globe. So it's a bundle of fibers. As soon as they enter inside the eye, they distribute in 360-degree angle, right? A bundle has come inside and that has to spread. So immediately all the fibers are separated and there will be a deficient portion in the center, and that portion is called as optic cup. Optic disc is a circular portion of the optic nerve that has entered inside the globe, right? As soon as it enters inside the globe, that spreads and revolve all around the retina in 360-degree angle, and there is a deficient portion in the center is called as cup, that is optic cup. Optic disc is the entrance point of optic nerve inside the globe, and optic cup is a deficient part in the center. And this is the first landmark of your posterior segment examination, right? Everyone has optic disc, everyone has optic cup, right? So I will show you a normal retina image how you look in the model, right? So this is a glowing sun, right? And the normal color of optic disc is ivory color, right? Ivory color, and the center part is called as optic cup. and all the vessels are arising from the center portion, right? And this is the first landmark in the examination of posterior segment of eye, right? Full glaucoma gauze slit. This slit is used to identify the elevated and depressed areas of the retina, right? And this is cobalt blue filter. So this ophthalmoscope can be used for the examination of anterior segment even, right? So there are two types of, now first you learn how to hold this. How I told, likewise you hold this. Lens indicator, right? Viewing window. ಹಿಂಗೆ ಹಿಡಿದು ನೋಡ್ರಿ, ನಿಮ್ಮ ಭವಿಷ್ಯ ನಿಮ್ಮ ಕೈಲಿರ್ತದೆ, ನೀವು ನೋಡಬೇಕಲ್ಲಿ ನೋಡ್ರಿ. This instrument to be held in right hand for the right hand users and left hand for the left hand users, right? But when you examine the patient's eye, follow the rule right, left, left. Means right hand, right eye and right eye of the patient. और else नाक बीच में आती है, ठीक है? राइट लेफ्ट राइट हैंड, राइट आई एंड राइट आई ऑफ द पेशेंट, ठीक है? तो अभी क्या करो, टाइम बिंग पहले इससे देखने की कोशिश करने के लिए लेंस ट्रे को 0 पे सेट करो, ठीक है? विविंग विंडो को आपकी आंखों को लगाओ, दोनों आंखों से भी देख सकते, एक आंखों से भी देख सकते, ऐसा करके हाथ की तरह नहीं मिलेगा। तो ऐसा करके खुद का हाथ में जो लाइंस रहते हैं वो क्लियर दिखते थे क्या, ऐसे देखना, देखो कोशिश भविष्य देखो, इतना दूर से नहीं दिखता हो, नज़दीक देखना पड़ता है। दिख रहे? ऐसे नहीं पकड़ने का, ऐसे नहीं घुमाने। सो इन ऑप्थेल्मोलॉजी यू हैव टू यूज बोथ द हैंड्स एफिशिएंटली, ऐसे करके देखने के लिए दोनों हाथ भी यूज़ करने के लिए आना है, नहीं तो फिर ऐसे पकड़ के फिर इस हाथ से ऐसे घुमाने का, ऐसा नहीं। ಇದು ಓಪನ್ ಮಾಡಿ ನಿನ್ನ ಕೈ ಯಾರು ನೋಡಾಕಿ, ನೀ ಕೈ ಹಿಡ್ಕೋ, ಯಾಕೆ ನೋಡಲಿ, ಇನ್ನೊಟ್ಟು ಸಮೀಪ ತಗೋ. ಅಡ್ಜಸ್ಟ್ ದ ಲೆನ್ಸಸ್ as good as the fine tuning of camera, microscope accordingly, right? जब तक आपको अच्छा नहीं दिखेगा तब तक आप लेंस ट्रे को घुमाते रहने का. That should match the refractive power of an observer as well as the denseness of the vitreous in the patient and the deficient portions of the patient. जैसे भी मीडिया डेंस है तो उसमें आपको पावर एड ऑन करके देखना पड़ता है. हाई हाइपरोपिया है तो पावर रिड्यूस करने का, हाई मायोपिया है तो पावर ज़्यादा करने का. तो वी हैव फ्रीडम ऑफ लेंसेज फ्रॉम प्लस और माइनस 1 to 40 तक पावर रहता है हमारे पास. तो लेंस स्पेक्टेकल इज़ नॉट अ बैरियर टू एग्जामिन द ऑप्थेल्मोस्कोप. ये देखो चश्मा को ऊपर चला गया वो. Viewing window should align with your pupillary axis, visual axis. ಇತ್ತಿಗೆ ಅದೆಲ್ಲ ಕಾಣಿಸ್ತೈತಿ. ನಾ ಅದೇ ಹೇಳಿದ್ನಲ್ಲ ಆಗಲೇ, ನಿನಗೆ ಎಲ್ಲಿ ಮಟ್ಟ ಕಾಣಿಸೋದಿಲ್ಲ ಅಲ್ಲಿ ಮಟ್ಟ ಹಿಂಗೆ ಮಾಡ್ಕೊಟ್ಕೊಂಡ್ರು. ಲೆನ್ಸ್ಗಳು ಅದಾವ ಅದ್ರಾಗ. ಆನ್ ಮಾಡು ನೋಡ್ಕೊತ್ಕೊಂಡ್ರು. ಇಲ್ಲ ಆನ್ ಮಾಡಿಲ್ಲ, ಆನೇ ಮಾಡಿಲ್ಲ. ಹೊಳಸ್ಬೇಕಂತ ಹೇಳಿಲ್ಲ. ಇದು ಚಾಲು ಬಂದ್ ಬಟನ್ ಅಲ್ಲದ, ಇಂಟೆನ್ಸಿಟಿ ಅಡ್ಜಸ್ಟ್ಮೆಂಟ್ಸ್. How this is used for the examination? We have two types of ophthalmoscopies. One is direct distance ophthalmoscopy and the close ophthalmoscopy. Direct distance ophthalmoscopy and close ophthalmoscopy, right? In direct distance ophthalmoscopy, you have to examine the patient within an arm distance. let the patient sit in front of you with an arm distance, ये arm distance. अब किसी का 1 मीटर रहता है, किसी का छोटा रहता है, किसी का कुछ तो भी नियर बाई अप्रोक्सीमेटली विद इन 1 मीटर पेशेंट हैज़ टू सिट. अगर आपका बैटरी लो हो गया है तो 1 मीटर से कम भी बिठा सकते हो. अगर आपके पास सफिशिएंट इल्यूमिनेशन है तो 1 मीटर इज अप्रोक्सीमेटली फाइन डिस्टेंस, राइट. सो दैट इज direct distance ophthalmoscopy. Direct distance ophthalmoscopy is used for identification of the glow, right. So our eyeball is a closed cavity. It's a closed cavity. It's a dark closed cavity, right. It's a dark closed cavity with a small central hole called pupil, right. तो ये रूम में अगर सब बंद करके रख दिया तो ये क्या हो जाता है, डार्क हो जाता है, ठीक है. और कहीं से भी एक होल मार लिए तो क्या होता है, एक ही बीम में लाइट आ जाता है. अगर बाहर से देखा जाए तो उधर से रिफ्लेक्शन भी दिखता है, ठीक है. एंड दैट होल रिफ्लेक्ट बैक द इंसिडेंट लाइट रेज गिविंग ए ग्लो, राइट. ये तो पूरा डार्क रहता है तो उसमें थोड़ा सा लाइट डालेगा तो अंदर से आपको रेड दिखेगा, एक ग्लो दिखेगा. द इंटेंसिटी ऑफ द रेड कलर इज डायरेक्टली प्रोपोर्शनेट विद द क्वालिटी ऑफ विजन ऑफ द पेशेंट. इफ द रेड ग्लो इज वेरी शाइनी एंड एब्सोल्युटली like a prominent one, then it is said that patient has good vision. If the quality of or the intensity of the glow is less, then the patient has poor vision. जैसे कि आपके पास वो मैडम है, क्या नाम है आपका, सोहा है, अंबिका है, those are wearing high power glasses. They have good vision, but that is with the glasses, right. If they remove their glasses and you see her glow, then you find that the glow is very dull, right. The glow is very dull. This means they have poor vision. Poor vision for distance. Distance vision always corresponds with the near vision, right. नियर विजन आप चश्मा निकाल के कैसे पढ़ाई करते हो, चश्मा निकालने के बाद कैसे पढ़ाई करते हो, पढ़ सकते, निकालो चश्मा, मैं दिखाते तुमको, निकालो तुम्हारा टेक्स्ट बुक. डोंट फील बैड. सो सिंस वी डोंट हैव इनफ पेशेंट्स, you are all wearing glasses, including me, all are the ophthalmopedy patients, right. अभी पढ़ो, दिख रहे, दिखते दिखते, तुम देखो, अभी देखो, अभी देखो. हाँ. So high myopes, there are two things, like whatever the quantity of distance vision you have will corresponds with the near vision. In distance vision we have 6/60, 6/36, we have 6/24, 6/18, 6/12, 6/9, 6/6, 6/5, 6/4, 6/3, 6/2, 6/1, right. That will exactly correlate with the near vision. N36, N24, N18, N12, N9, N8, N6, not below that. 5, 2, 4, 3, 2 Viradullah, right. This is the one. The second one is the quality of vision. Quality of vision is directly proportional with the direct distance glow. जो भी आपको ग्लो दिखेगा उससे आपको समझ में आता है कि you have good vision or you have poor vision. If you have media opacities means refractive medias. All the refractive medias are colorless. We have refractive media starting from tear film, cornea, aqueous humor, pupil. Pupil is there? Pupil is there? Why? Pupil is not a refractive media because that's a deficient portion of the iris. That's not at all a structure, right? That keeps on changing its shape. Even the shape is also not fixed. So that's why that's not a refractive media. The first refractive media begins with the tear film, cornea. Both the surfaces of cornea act differently. Both the surfaces of cornea acts differently, right? So tear film, cornea, aqueous humor, both the capsule of the lens and the lens. So collectively called as lens, vitreous humor, and then end of. So any of the media opacities in the tear film or in the cornea, aqueous humor, lens and the vitreous can be seen with the direct distance ophthalmoscopy. So there are only two major benefits of, or the two clinical points which we identify with the direct distance ophthalmoscopy is, number one is the quantity of vision based on the quality of the glow, and if the glow is very pale, pale means the red becomes white, that is pale, right? Then there is no vision at all. Pale vision, right? When you see through the ophthalmoscope and you see a white spot which was expectedly a red spot, then that is called as white pupil. White pupil is indicative of two diseases, retinoblastoma and senile hypermature cataract. समझ में आ रहा है? डायरेक्ट डिस्टेंस ऑप्थेल्मोस्कोपी में दो ही चीज़ें करना है, एक तो ग्लो देखना है, दूसरा मीडिया ओपेसिटी देखना है. उससे हम ना ही रिफ्रैक्शन कर सकते हैं, ना ही उसको कुछ दवाई लिख सकते हैं. We'll have a rough estimate of the patient's vision. Rough estimate of the patient's vision. If the patient, very simple example, I'll have an instance. So when you sit in OPD in the early morning, 9 o'clock, right? Mother carries her kid with the complaint of, my son or my daughter cannot see anything. Cannot see anything. All of a sudden, stop seeing the things. बच्चा तो हंसते खेलते आएगा, अपने अपने जगह पे बैठेगा, सब देखेगा, लेकिन वो बोलेगा मेरे को कुछ दिख रहा नहीं. आपको स्नेल चैट पे पढ़ाएगा, कुछ नहीं दिख रहा मेरे को, बोलेगा वो. क्यों? क्योंकि उसको सुबह एग्जाम रहता है, कल पढ़ाई नहीं किया रहता है. तो दिस काइंड ऑफ situations are called as malingering, where the patient purposely say that they don't have vision, right? These things can be differentiated with the help of direct distance ophthalmoscopy itself. Direct distance ophthalmoscopy is meant to identify glow of the patient that gives you the estimate vision. The second one is identify the media opacities. The close ophthalmoscopy is for identification of only posterior segment, where you have to approach, इधर बैठ इधर फेस करके, इधर फेस. So this is a patient, right? Direct distance ophthalmoscopy begins with an arm distance. ठीक है? सामने देख, within an arm distance. If your illumination and the pupils are coinciding, then you will have pupillary reaction. You put the light over the pupil from this side, you may not have pupillary reaction. This doesn't mean he is dead, right? Unless the pupil are nothing but a fold of muscles. They don't have any photoreceptors. Unless the light enters inside the eye, the light is being pursued by the retina, reaches the signal still in brain, you won't get pupillary reaction, right? So you have to see the glow. You have to send the light indirectly inside the patient's eye. If you put the light directly through the pupil, the light will be perceived and the pupil will be constricted. You will have very small glow. That may give you the wrong diagnosis. So always ask the patient to look straight, move temporally, क्योंकि इधर से नाक बीच में आ जाती है. Move temporally, look at the glow, adjust, सामने देख रहे हैं. Adjust your refractive area, refractive errors and the indices difference, right? And look at the glow, right? कौन सा पावर से हमसे एडजस्ट हो रहा है? हाँ, ये पावर से ठीक से एडजस्ट हो रहा है. क्या पावर का है? 1 +1 को मेरे को एडजस्ट हो गया. ठीक है. दैट वेरीज फ्रॉम द पेशेंट टू पेशेंट, डिस्टेंस टू डिस्टेंस, नॉट ऑलवेज विद द सेम पावर, राइट. ये हमारा डायरेक्ट डिस्टेंस ऑप्थेल्मोस्कोपी देखने का तरीका. ठीक है. विद इन एन आर्म डिस्टेंस मूव टेम्पोरली. इसका वीक हो गया है थोड़ा सेल, तो इसलिए थोड़ा सा नज़दीक जाके देखना पड़ रहा है. उसका ज़रा स्ट्रांग है. दिस इज द एडवांटेज ऑफ रिचार्जेबल हैंडल. रिचार्जेबल हैंडल विल वर्क टिल इट एग्जॉस्ट कंप्लीटली विद द सेम इल्यूमिनेशन. इसमें क्या होता है, पहले कुछ दिन मस्त दिखता है, बाद में धीरे 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 स्लो 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 होते जाता है और एक दिन मर जाता है. लेकिन इसमें ऐसे नहीं, वो वीक हो गया तो एक ही बार बंद हो जाता है. ये ऐसे नहीं, बहुत दिन तक टिकता है. ठीक है. तो ऐसे देखने का, ये ग्लो दिख गया. अभी ये डायरेक्ट डिस्टेंस ऑप्थेल्मोस्कोपी है. क्लोज ऑप्थेल्मोस्कोपी के लिए सामने देख रहे, यू हैव टू एंटर हिज रेटिना थ्रू द प्यूपिल. ऐसे अंदर जाने का, अंदर जाने के बाद हमको कुछ ब्लड वेसल्स दिखते हैं. ठीक है. वो ब्लड वेसल्स को फॉलो करने का और सेंटर में जो ये ऑप्टिक डिस्क दिख रहा है ना, उसको कंसंट्रेट करने का. ये सब्जेक्ट है. मैं तुमको जस्ट ऐसे मूव करने का दिखा रहे, ये आपका सब्जेक्ट है. तो आपको ऐसे लाइट डाल के इसके अंदर जाके ब्लड वेसल्स को देख के ऑप्टिक डिस्क को ट्रेस करना है. ठीक है. ऑप्टिक डिस्क ट्रेस करना है. उसके बाजू में से ब्लड वेसल्स आते हैं, तो ब्लड वेसल्स किधर जा रहे हैं, डिस्क का कलर क्या है, ब्लीडिंग कैसे होता है, उसमें कौन सा डिसीज है, वो सब दिखता है इसमें. ठीक है. ये आपका ऑब्जेक्ट है जिसमें से आपको देखना है. ठीक है. ऑप्टिक डिस्क ऐसे रहता है. ये ऑप्टिक डिस्क जो रहता है ना, वो हमारा फर्स्ट पॉइंट ऑफ फोकस रहेगा. वहाँ से हम एक एक चीज़ें देखते जाने का. फर्स्ट इज ऑप्टिक डिस्क. ऑप्टिक डिस्क शुड बी एग्जामिन्ड फॉर इट्स कलर फर्स्ट, ivory color, cup and disc. Usually that is 0.3, means 1/3 of the portion of the whole disc will be cup, and that should be there. The central hole of the glaucoma gauze represents 0.3 mm, and then 0.5 mm, 0.7 mm, 0.9 mm lines are there. If that cup is corresponding with those lines, that is called increased cup disc ratio. Cup disc ratio do not decrease. Why? Because that's a deficient part of the optic nerve fibers that has emerged inside the globe. वो कम हो ही नहीं सकता है. ठीक है. वो बढ़ते जा सकता है, because there might be some external pressure which has made them to spread away, or death of neuroglial cells and the supporting cells in the optic nerve, that makes the optic disc and cup to increase, right? तो ये हमको तरीका है, इसको ऐसे करने का है. ऐसे देके ऐसे अंदर जाके पहले ऑप्टिक डिस्क और ऑप्टिक कप को ट्रेस करना है. Then slowly move your hand towards the nasally and you will have a glowing star. You will have a glowing star called macula, right? Fovea centralis is an area, and the center portion of that is called as a macula. That you examine, right? In normal healthy individuals, that will be a glowing star. With the high myopes or with macular diseases, that shining comes down, right? First identify optic disc, optic cup and the vessels emerging out of that. slowly move towards the temporal side, identify the macula, then again go to the optic disc, follow the course of each vessel. वो किधर जा रहा है, ऊपर जा रहा है, नीचे जा रहा है, तो उसमें कुछ बंडल्स हो गए क्या, यानी there are new vessels are formed along with the bundles of the blood vessels. That is called neovascularization. Neovascularization. New vessels are arised. If they are at the optic disc, then it is called as NVD, neovascularization of the disc. If they are elsewhere away from the optic disc, then it is called NVE, neovascularization elsewhere, right? There are few dots, right? Obviously, arteries and veins carries blood. Arteries and veins carries blood, and in vasculopathies like diabetic retinopathy, these blood vessels start leaking and they gives you out the blood. If that blood is in the initial stage, will look as a soft exudate. एक बहुत छोटा सा ड्रॉप गिर गया, that looks as a soft exudate. वो थोड़ा सा ज़्यादा हो गया तो क्या होता है, that is dot and blot hemorrhage. अब डॉट है, एक डॉट तो समझता है आपको, डॉट उतना सा है, तो दैट when you look through the ophthalmoscope, that will look as a soft exudate, right? And if that dot is bigger, then that looks as a dot and blot hemorrhage. जैसे कि आपको एक चीज़ पता रहनी है, we have avascular structures in eye. कौन से है जहाँ ब्लड वेसल्स नहीं है, वो वाले, वो तो जेल है. कॉर्निया, और एक फॉर्मूला याद रखो, all the colorless subjects makes us aware with the colorful universe. Okay? All the colorless subjects makes us aware with the colorful universe. हमारे आँख में जो भी स्ट्रक्चर्स आएगा, जिसको भी कलर रहेगा, वो कोई काम की चीज़ नहीं है, और जो भी कलरलेस चीज़ है सभी काम की चीज़ें हैं. काम आँखों का एक ही है, क्या है, विजन. टू सी द थिंग्स ऑल द कलरलेस सब्जेक्ट्स आर रिक्वायर्ड, स्टार्टिंग फ्रॉम टेयर फिल्म. अगर टेयर फिल्म में हम ब्लू कलर डाल दिए तो क्या हो जाता है, यू विल सी द थिंग्स ब्लू. चश्मा ट्रांसपेरेंट ग्लास है, इसको आप गॉगल बना लिए तो क्या होता है, सभी काला काला दिखता है. नाइट विजन ग्लासेस येलो लगा लो, वो पूरा पीला पीला दिखेगा, नीला दिखेगा. ठीक है. कॉर्निया, उसमें भी ब्लड वेसल्स नहीं है. 2 millimeter of the limbus has the blood supply, but the rest of the cornea doesn't have, right? लेंस में भी नहीं है. विट्रियस में इंट्राएम्ब्रियोनिक लाइफ में एक रहता है, पैदा होने के बाद वो बंद हो जाता है, हाइलोइड कैनाल बोलते हैं उसको बाद में. ठीक है, वो रहता है. In 15 years of my career, I have seen only one case of persistent hyaloid canal with the blood in the vitreous cavity which has not entered the vitreous. It was still in position. ठीक है. Retina doesn't have blood supply and even doesn't have any color. You are seeing here retina with the which color? Pink, ivory, red, whatever color we are seeing here is actually the reflection of the light from the choroid. Choroid is a vascular layer of coat of the eyeball that has the blood vessels. When you put the light is reflected back from the choroid in the form of red glow, and we see the retina with the red color. But actually retina is colorless, transparent, mucus like membrane with the 10 layers. ठीक है, समझ में आया? So that is colorless and there won't be blood vessels in the retina. अगर रेटिना में, कॉर्निया में, लेंस में, सब जगह अगर ब्लड वेसल्स चले जाए तो क्या होता है? नंबर 1, all these things will be having द टेंडेंसी टू हैव ब्लड बॉर्न डिसीजेस. टाइफाइड हो गया, आपकी आँख खराब हो गई, खत्म. ठीक है. सो दीज स्ट्रक्चर्स आर डिवाइड ऑफ ब्लड वेसल्स, मीन्स दीज हैव द इम्यूनिटी अगेंस्ट द ब्लड बॉर्न डिसीजेस. ब्लड, हमको कुछ भी हो जाए, हमको सभी ब्लड में ही रहता है. आपको टाइफाइड हो गया, मलेरिया हो गया, डेंगू हो गया, ब्लड चेक करेगा. आप क्या कुछ भी होने दो, करने का क्या है? ब्लड चेक. क्यों? दैट इज द ओनली यूनिवर्सल सोर्स फॉर द सप्लाई एज वेल एज द क्लियरेंस. दैट इज द ओनली media of supply and clearance. Carries the blood, carries the oxygen to the tissues and removes the waste, right? But this is not the case in eye. These structures are avascular, so that's why the general rule of your body doesn't apply in eye. So these are free from the blood-borne diseases. Number 2, usually they don't get disease, and if they get any disease, there won't be any cure. यूजुअली कुछ होता नहीं, हुआ तो कुछ कर नहीं सकते, यही आंसर है उसको. ठीक है. तो आपको समझना है हेमरेजेस कैसे होते हैं. हेमरेजेस तो एक्चुअली होते कोरोइड में हैं, लेकिन दिखते रेटिना से हैं. रेटिना के लेयर्स में वो ब्लड ट्रांसफ्यूज होता है, जैसे डिफ्यूजन से ट्रांसफ्यूज होके बाद में आता है, लेकिन इनिशियली एक डॉट रहता है, बाद में उसमें से जो फ्लूइड रिफ्लेक्ट होके डॉट एंड ब्लॉट होता है, बाद में होता है नेविकुलर हेमरेजेस. नेविकुलर हेमरेजेस है, उसका एक शेप बन जाता है नेविस सर का, ऐसा बोट के सर का एक शेप बन जाता है. नेविकुलर हेमरेजेस. स्प्रिंगचिक हेमरेजेस, इफ द ब्लीडिंग ऑकर्स एट द optic disc or nearer to the optic disc, where the fibers of the optic nerve enters throughout the globe, will have a streaks of, जैसे आप सन बनाने के बाद ऐसे लाइन्स बनाते हैं ना, तो ऐसे लाइन 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 हेमरेज हो गया, then that is called as sphincteric hemorrhages. स्पिंक्टर रहते हैं ना, वैसे sphincteric hemorrhages. So we have dot hemorrhage, we have dot and blot hemorrhage, we have navicular hemorrhage, we have frank bleed, and we have sphincteric hemorrhage. इतना हेमरेजेस, वो सब इसमें देखने का. ठीक है. उसके बाद अभी ब्लड तो हर जगह जाना है कोरोइड में, अगर किस एरिया में ब्लड नहीं गया तो उसको हम बोलते हैं अवेस्कुलर एरियाज ऑफ द रेटिना. रेटिना इटसेल्फ इज अ वेस्कुलर, बट सम chorioretinal part where the blood supply has reduced, that is called as cotton wool spots. These are called hypoxic areas of the retina. Cotton wool spots. कॉटन वूल देखा है आपने, कॉटन लेने का, उसमें से ऐसे वूल निकाल के देखने का, तो दीज आर ऑलमोस्ट सेमी परमेबल मेम्ब्रेन्स, लेकिन चीज़ें क्लियरली नहीं दिखते. सो दैट काइंड ऑफ सुपरफिशियल spots are called as cotton wool spots. We have irma, that is arterio and venous system irregularities that we have to examine. We have to examine the pattern of the blood vessels. So we have arteries and veins. Can you identify which one is artery and which one is vein? इसमें ये आर्टरी है कि ये वेन है, कि कौन सा कौन, ये आर्टरी है, ये आर्टरी है, ये आर्टरी है, कौन सा बोल सकते हैं? हाँ, इधर दिख रहा है ना, ये कौन सा है, ये कौन सा है, ये आर्टरी है या ये आर्टरी है? ಯಾವುದು ಇದು ಇದು ಯಾವುದು? ಇದು ವೇನ್, ಇದು 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 ಆರ್ಟರಿನೋ ವೇನೋ? ಇದು ಇದು how you have differentiated? Arteries carries and represented with bright red color. Means bright red color is this. Oxygenated blood is represented with a dark color, right? Then this is dark red. Then this might be artery. Oxygenated blood red रहता है, तो इन दोनों में ज़्यादा रेड कौन सा है? कौन सा है? ये ज़्यादा रेड है, ये ज़्यादा रेड है? कौन सा है? ये है, ये बी है। ये ज़्यादा रेड है, बी ज़्यादा रेड है? तो बी आर्टरी है, वेन है। वेन कैरीज डीऑक्सीजनेटेड ब्लड विच इज रिप्रेजेंटेड बाय ब्लूइश कलर। तो ये ब्लू दिखना है ना इधर। फॉर ड्राइंग पर्पस व्हाट वी डू, द veins are represented with the bluish color and the arteries are represented with the red color, but that is not the scenario here. Arteries are smaller, transparent, and less prominent than the vein. Less prominent than the vein. Why? Why? Because the lumen is smaller and the walls are very elastic. That has to maintain the pressure barrier in between the arteries and vein. Because to happen the perfusion, the pressure of the blood should be higher into the arteries than the veins. तो इसलिए वॉल्यूम बढ़ गया तो प्रेशर फॉल्स। तो इधर वॉल्यूम बढ़ गया, प्रेशर फॉल्स। समझ में आ रहा है? एंड डिफ्यूजन, परफ्यूजन, वॉट एवर द थिंग्स ऑफ एक्सचेंजेस हैपन फ्रॉम द आर्टरीज एंड वेन्स इज ऑल based on the pressure gradient. So that's why the arteries are thin, small and as good as the semi-transparent membranes, right? Whereas the veins are big, prominently seen with the wider lumen. ठीक है? तो ये arteries and veins to be examined. ठीक है? तो अभी क्या करो, एक बार मॉडल देखो और इसके साथ साथ इसका आँख देखो, आर्टरीज एंड वेन लाइवली देखो। और देखने में क्या करने का है? पहला, आइडेंटिफाई ऑप्टिक डिस्क, आइडेंटिफाई द इमर्जिंग ऑफ वेसल्स एंड फॉलो ईच वेसल। अंदर जाओ, दिख रहा है कुछ? अंदर जाके देखो। हाँ, ऑप्टिक डिस्क दिखा? उसको एक एक ब्लड वेसल को फॉलो करो। फॉलो करने का, फॉलो करके नहीं, इसको ऐसे ऐसे घुमाने का, इसको घुमाने का, उसको ऐसे ऐसे घूम के अंदर देखने का। इसमें तो प्यूपिलरी रिएक्शन नहीं आएगा, इसमें आएगा। सेंटर में ऐसे घूमेगा तो दिखना बंद हो जाता है। फॉलो द रूल, राइट राइट राइट, लेफ्ट लेफ्ट लेफ्ट। ठीक है? ऑप्टिक डिस्क, ऑप्टिक कप, फॉलो द आर्टरीज। Once you trace the optic disc, move temporally 3 to 5 millimeters, you will have a glowing star, that is macula. तो उसको उतना देखो।